Hey everyone, this is Victor Abafe with A Healthier Democracy, and today I want to talk about hospital tax exemptions. According to various estimates, between 49 and 58% of US hospitals are classified as nonprofits for tax purposes. This nonprofit designation was formally granted to hospitals via an IRS ruling in 1956 that provided hospitals that chose to become tax exempt with that status if they provided charity care to those who couldn't afford healthcare otherwise. In 1969, 4 years after Medicare and Medicaid was enacted into law, the IRS broadened the scope of what could be considered as charity care into what is now classified as community benefit. Under this expanded community benefit standard, a hospital could retain its tax-exempt status if it operated an emergency room that treated all patients regardless of their ability to pay, participated in the then newly created Medicare and Medicaid programs, created a governing board with representation from the community, and reinvested its funds rather than distributing these funds as shareholder dividends. A 1983 ruling further relaxed the emergency care requirements for tax-exempt status. Now, over time, there's been growing criticism as to whether these hospitals are really doing this community benefit in exchange for this tax-exempt status. A 2008 revision of IRS regulations required hospitals to submit a more detailed account of the community benefits that they provide via a Schedule H form. Additionally, the Affordable Care Act, which was enacted into law in 2010, mandates that hospitals conduct community health needs assessments and create a community health implementation plan every 3 years in order to maintain their tax-exempt status. Now, critics of nonprofit status argue that 80% of nonprofit hospitals spend less on community benefit than they receive in tax rates. They also highlight aggressive debt collection practices targeting patients who seek emergency care as being contrary to the very supposed mission and goals of these nonprofit entities. The amount of taxes that nonprofit hospitals collectively do not pay every year is about $37 billion. To reform these tax exemptions to make sure they serve their intended purposes, 5 states, including Texas, Illinois, Nevada, Pennsylvania, and Utah, have established minimum spending requirements on community benefits in order for nonprofit hospitals to keep their nonprofit designation. Furthermore, the AMA supports efforts to ban predatory billing practices among nonprofit hospitals, along with efforts to simplify patient financial assistance processes. There are also initiatives aimed at more clearly defining what qualifies as a community benefit. To that end, Montana passed legislation in 2023 mandating that state health departments define community benefit standards more clearly and publicly track hospitals' charity giving rates. Given the significant impact that this tax advantage has on hospitals, it is essential that the proper incentives are in place to ensure that nonprofit hospitals are truly providing that community impact that nonprofit tax designation is meant to incentivize.